ಹಾಯ್ ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ನಿಮ್ಮ ಸಂದೀಪ್. ವೆಲ್ಕಮ್ ಟು Sunshine Nursing Skill Studios. It takes a great pleasure to introduce Mrs. Shaini McIntyre, Associate Professor who works for a College of Nursing in Bangalore. She has come forward to share details about hematological disorders. Yes, in today's slide we are going to see about hematological disorders, that is assessment, starting from the assessment to the evaluation, which comes under hematological disorders. So come, let's see this chapter in detail.
Good morning to everybody. Today we are here to listen a class about hematological disorders. It is a conjoined unit along with the cardiovascular system. So let us see about this chapter in detail. Before starting with the hematological disease condition, let us brush up about the hematological assessment. As we all know, in assessment we have two types of data. One is subjective data, another one is objective data. In subjective data, we'll mainly concentrate on history collection, and in objective data, we'll mainly go with the physical examination, that is what we observe, the lab investigation, radiological studies, and etc. So at first, we'll see about subjective data, that is history collection. In hematological and immunological disorders, the major history will be based on the demographical data, that is the age and sex of the individual, irrespective of gender, male or female, and based on their race and ethnic background, the disease conditions will be based. So along with the demographical data, we'll collect present and past medical and surgical history, dietary history, family history, personal and social history, and menstrual history. Coming to the in-depth information about present and past medical and surgical history, we have to ask for any history of fatigue currently, any history of trauma or injury with a massive blood loss, whether there were any history of surgical intervention wherein there was a more than expected blood loss happened during or after the surgery, history of recurrent infections again and again, was it there? And also we have to ask for the past history of anemia, bleeding disorders, or blood disease such as leukemia and other related health conditions. History of spleen and liver surgeries, because spleen and liver are those organs wherein the red blood damaged cells will be taken care of. The lifespan, the end span of the red blood cells will be in the spleen. History of renal transplantation, because kidneys are the major organ where erythropoiesis will occur. So whether there is any history of renal transplantation or any kidney diseases, problem with the blood clotting, history of infections. Next, coming to the dietary history, we know everybody will eat food, whether those food is requiring their body needs. We have to see that the balanced diet. Maybe some people will eat food wherein that food will not have adequate amount of protein, calories, vitamins, minerals, trace elements like iron and zinc, etc. So we have to encourage the patients to have rich green leafy vegetables along with a high protein and high calorie diet, and a vitamin-rich diet which includes all the vitamin B components. And in case of increased nutritional needs like pregnancy, lactation, or in case of hypercarbolic state like thermal injuries related to burns, etc., in these cases we have to provide excessive nutrition, not more than a normal diet. Next, coming to the family history, we have to ask for the family history of bleeding disorder like anemia, hemophilia, thrombocytopenia, von Willebrand's diseases, etc. So let us see about each disease condition in depth in the future classes. Next, coming to the social history, we have to ask for the history of smoking and alcoholism, which are directly affecting the hematological system. Use of hydrocarbons for household things like kerosene and gasoline, which will release the hydrocarbons which are more harmful for the destruction of hemoglobin in the blood. Stress, use of insecticides and chemical factory workers. If these are the history, they are at a risk of getting decreased hemoglobin count in their body. So up to now we saw about what and all history we have to collect for the patient coming with a hematological disorder. So the next thing after collecting the history which we are going to assess is our systemic examination, or also called as physical examination. In physical examination, the major thing we'll concentrate is about head to toe examination. In this, we will see for the skin, eyes, nose, mouth, the cardiovascular and respiratory system, the digestive system, and nervous system, musculoskeletal system, and the reproductive system. So let us see what is there in each system. Firstly, we are going to assess the skin, because the major changes of the hematological system will be founded in the skin. So in skin, pallor. Pallor is nothing but a decreased or absence of the skin coloration. The skin will look very pale enough. That is called as pallor, which we can see in the decreased HP level condition. Flushing. Flushing is transient episodic redness of the skin, which can be seen in polycythemia or congestion of the capillaries, or if there is an increase in the hemoglobin count in the blood, then also we can see the flushing. Jaundice, yellow color appearance of the skin and mucous membrane, wherein there will be accumulation of the bile pigment, which is caused by rapid or excessive hemolysis or the liver damage. Cyanosis, bluish discoloration of the skin because of the decreased blood circulation in the body. Excoriation, a scratch or abrasion of the skin. Pruritus, an undesirable scratch. Itching in the skin. Angiomas, a benign tumor consisting of blood or lymph vessels. Leg ulcers, these leg ulcers in hematological condition are prominent in malleoli of the ankles, which we can see in the disease condition called as sickle cell anemia. Petechiae, they are the pinpoint non-raised perfectly round area which is purple or dark red or dark brown in color. This can be seen in conditions like decreased platelet counts or alteration in the clotting factors, etc. Purpura and ecchymosis, they are also a kind of a small lesions, wherein this purpura is characterized by a small group of condition which is characterized by ecchymosis and other small hemorrhages, and ecchymosis itself is a hemorrhagic spot which is larger than the petechiae. And next, coming to the hematoma, it is a localized collection of blood which is usually clotted in the skin region. Grey tan or bronze skin color, this will be specially seen in the genitalia, in the scars and the exposed area of the drug body, and it is caused in hemochromatosis, a disease condition called hemochromatosis. The picture which you can see here, it shows the grey tan or bronze skin appearance. And the next one is telangiectasia. Telangiectasia is a small angioma which has a tendency to bleed, and also it is a focal red lesions which is coarse or fine red lines. So here are some of the pictures. Here are some of the pictures which shows the skin abnormalities in hematological system. That is pallor, jaundice, ecchymosis, cyanosis, purpura, pruritus, petechiae, hematoma, and telangiectasia. Next, moving on to the assessment of the eyes. In the eyes, we'll mainly see for the scleral examination, and then we'll go for the conjunctival examination for the paleness or pallor. We have to ask for the patient whether the patient is having any sorts of blurred vision. In case of decreased blood count, there will be a history of blurred vision and any signs of diplopia present in the patient. So this is how we will do the conjunctival examination as shown in the picture 1, and the down picture 2 are both represents the scleral examination, and that one picture of the hand shows the diplopia. Next, moving on to the assessment of the nose and mouth. In nose, the major symptom will be epistaxis, that is nothing but bleeding from the nose. And in mouth, the paleness, ulceration, swelling and bleeding will be seen in the mucous membrane as well as in the lips. And assessment of lymph nodes, when we come, there will be enlargement of lymph nodes termed as lymphadenopathy. These are the pictures representing the alterations in the assessment of nose, mouth and lymph nodes. Assessment of heart and chest. The person will be shown with a distended neck veins and they will have tachycardia along with a palpitation, alteration in the blood pressure. It can be hypotension or it can be hypertension. Sternal tenderness in case of abnormality or if in case of leukemia. Low oxygen saturation in case of low HP level. Chest pain on exertion. Increased respiratory rate. Adventitious breath sounds like crackles, wheeze, etc. can be seen as the alteration in the heart and chest. Abdominal examination, mainly the person's abdomen will be distended in relation to hepatomegaly or splenomegaly, and the person will have stool positive for blood. When they are passing the stools, there will be a blood stain present on the stool which will be tested for the occult blood. Next, coming to the musculoskeletal assessment, majorly we will see for the bone pain, swelling in the joints, arthralgia, that is joint pain, as well as the back pain. And coming to the gynecological assessment, we will ask for the menstruation, menstrual history, how about the regularity of the menstrual flow, and whether the person is having any symptom of menorrhagia or metrorrhagia or any other signs of abnormal menstruation should be assessed. And the last system is neurological assessment. In neurological assessment, we will go for CNS assessment. If there is any CNS dysfunction because of the decreased blood supply to the brain, restlessness in the hands and feet, also known as paresthesias in the hands and feet, wherein the person will experience the numbness in the hands and feet, knuckle rigidity, ataxia, weakness and headache, alteration in the mental status, visual changes and peripheral nerve dysfunction can be seen as neurological changes in neurological system in hematological disorders. Next, moving on to the lab investigations and radiological studies. In lab investigation, we'll mainly go for the complete blood count and then ESR, that is nothing but erythrocyte sedimentation rate. Next, we'll go for the platelet counts, blood. Moving on to the complete blood count investigation, here we'll go for HB, that is measurement of oxygen carrying capacity of the cells. In men, it should be 13.5 to 18.0 gram per DL percentage, and in women, it should be 12 to 15 gram per DL. Hematocrit, it's a measure of packed cell volume of RBCs. Total RBC, number of circulating RBCs. WBC count is the total number of WBCs in the blood. Differential count of WBC is nothing but determination of each kind of WBC cells, that is neutrophils, eosinophils, basophils, lymphocytes and monocytes. Platelet counts, total number of platelets in the blood, that is 1.5 lakhs to 4.01 lakhs per milliliter. ESR, that is erythrocyte sedimentation rate, it measures the sedimented or settling of RBCs in the tube. In men, it should be 0 to 15 millimeter per hour, and in women, it should be 0 to 20 millimeter per hour. In case of any infection, any minor infection also, the ESR will be raised. And coming to the next factor, that is blood grouping and typing. In this, we have 4 types of blood group, that is A, B, AB and O. And for each type of blood group, there is an RBC antigen, that is A, B, A and B. And for O blood group, there is no RBC antigen. And coming to the serum antibody, blood group A will have anti-B antibodies, B will have anti-A antibodies, AB will not have any antibodies in it, and O will have both the antibodies anti-A and anti-B. And hence AB blood group people are called as the universal recipient and O is called as the universal donor. Coming to the radiological studies, we will go for abdominal ultrasound, positron emission test, PET scan, computerized tomography or CT scan, MRI and bone scan. In ultrasound scanning, we will mainly visualize for or we will mainly diagnose it for splenomegaly and hepatomegaly. And in bone scan, as for the spleen scan, except for evaluating the structure of the bones will be done. And in PET scan, there will be injecting a tracer substance and they will metabolically activate the cells, which shows any hotspots in the areas present in the scanning region. In signs of tumor, to suspect any malignancy, we will do the PET scan. So as the computerized tomography and magnetic resonance imaging, which will be done for evaluating the lymph nodes, spleen, liver and etc. for the malignancy and other complication in relation with the hematological system. Biopsies, bone marrow aspiration biopsy, wherein in bone marrow the major blood cells will be developed. So we will check for the bone marrow aspiration. In bone marrow, we will take a sample of bone marrow, will be investigated for the production of blood cells in the bone marrow stem cells. And in lymph node, the purpose will be obtained to diagnose for any malignancy in the lymph node, enlarged lymph nodes, and to determine the therapy based on the result. A lymph node biopsy will be done. Apart from that, the miscellaneous blood studies which will be done in the hematological system will include liver function test for the examination of bilirubin, Coombs test will differentiate among the types of hemolytic anemias, direct and indirect. There are two types of Coombs test, and we will go for the test of vitamin B12, iron, folic acid, zinc, etc. So these are the test, investigation, studies, examination and histories which we will do in the hematological assessment. So this is the end of the hematological assessment. Thank you.